Good morning, James.
Oh, hey, Merrick, how's it going? Oh,
Good, good.
Let's just do a best side report, okay?
Yeah, I want to know how's Mr. Martinez doing.
So this is Mr. Martinez.
How's his level of consciousness right now?
He's like consciousness. There's no corneal light reflexes, positive Babinski reflex.
Hey, Mr. Martinez.
Yeah, he needs like vigorous like stimulation to kind of get some response. He
Okay.
responds to pain by grimacing and flinching. He has been on a wheelchair for the past 10 years after falling off from a ladder and left him unable to use both legs. He was hit by a car on 3 separate occasions a few years later, and he had 2 CVAs after that, one ischemic and one hemorrhagic, which caused him to have left side deficits. He was able to express his needs to the family. He's full code. Unfortunately, no offense directed.
He's still full code?
Yeah, he's still full code.
Okay.
Family, the wife and the ex-wife is kind of disagreeing over his, like withdrawal of care and stuff like that. History of hypertension, hyperlipidemia, and atrial fib. Again, he has a huge family support system. He has one brother, one ex-wife, and one current wife.
What was his last blood pressure and his EKG? Any dysrhythmias?
Oh, okay. Vital sign. His latest set of vital signs is 98.7 temperature. His pulse, his baseline was 75. He's currently at 105.
Okay.
Respiratory is
It's a
20.
big change, right?
Yeah, it's kind of a big change. Blood pressure 141/66. I just medicated him. I just hang his morphine drip. He's currently at 98%. Oxygen sat. He's on, as you can see, he's on CMV. PEEP is 5. SaO2 is currently at 95. FiO2 is 60%.
How is his lung sounds?
Lung sounds is clear, diminished in the lower lows, but clear.
Heart stop.
Well, I would probably do like a family conference, bring the physician, social worker in to let the family know what is going on and let them express their concerns. You probably want to recommend DNR.
DNR, yeah, that's what I was wondering. Yeah, the patient is still full code. I want to know what the family wants. Go ahead and talk to Dr. Farhad and try to set everything up.
All right, so I'll finish up my documentation, and then if you have any more questions.
Great. Good morning, Dr. Farhad.
Hello.
Can I speak with you for a second about
Sure.
Jose Martinez?
Yeah, what's up?
60-year-old Hispanic male with this left subdural hematoma. Are you familiar with him?
Oh, yeah, him.
I just wanted to see if we can get together this morning with the family and have a little family conference around like 10 o'clock or so. Family, they have
Dr. Farhad. Baby, you can buy whatever you like. I'm a doctor. Sorry, I'm sorry about that.
No problem. No, so I just wanted to call a family conference for 10 o'clock with our team and make sure that the team and the family are on the same page.
Yeah, the social worker was just talking to me. You're well aware of their the family and what's going on. Yeah, oh man, it's all my children. Whew. Yeah, but okay, yeah, that's fine.
Sounds good.
Sounds good.
All right, I'll see you then.
Sure.
So I'm James, I'm the social worker, and this is Merrick, the primary nurse, and that's Dr. Fahad, the primary physician. This is Angela, the patient's ex-wife, and this is Jen, patient's current wife. So we're having this family conference to get an understanding of what you guys know about the patient's current situation. So why don't you guys start off by telling us what you guys understand about the patient's current situation?
Okay, well, from what I understand is that, I know he's not doing too well right now, but that I understand that we're just going to be keeping on with the feedings that we're giving him and, keeping the breathing machine on him. I feel like there's been so much drama going on with wanting to withdraw his care, but I feel like if he were able to talk to us right now, that he would want us to continue on with his care. I was married to him for 25 years, and I feel like I know what his wishes would have been, and that would have been to just continue on with his care, not give up hope. He's been through so much, and he's a fighter, and I just want him to keep fighting. So, that's where I'm at right now.
So what about you, Jen? What do you think?
Well, my husband's been through a lot. He's been disabled for the past 5 years. So we've discussed his healthcare wishes. I know he wouldn't want to be in he wouldn't want to suffer or be in pain for extended amount of time. And like he's lived a good life. He has 6 wonderful children, and we all just agree that we want him to pass comfortably. I know he'd want his care to be withdrawn.
I wanted you to tell the family what is your understanding of patient's situation. How do you see the prognosis at this point?
Well, at this point, I think you guys realize as well that it's pretty poor. We're doing everything we can right now, but he's not responding medically to treatment. He's probably got the cognitive function of a potato, if you don't mind me saying. I mean, it's really that bad. I just don't see anything happening. He's not going to be able to do what he used to do. Part of your husband's treatment plan from now on would be a DNR status, do not resuscitate. And what it means is that if your husband's heart stops beating, we're not going to medically intervene anymore. So no reintubation, no chest compressions, and no defibrillation, because at this point in time, it's pretty much futile, and it's just going to cause him more pain. And I think we can all agree on that it's not necessary.
Science, there's only so much it can do, and I feel like we know our limitations, and as Dr. Farhad said, I think we exhausted all our interventions that would help your husband. Actually, at this point, he's bleeding into his brain, and everything will not bring him back. So as I understand, in respect to your husband's wishes, we were thinking about palliative care, as Jen was saying. I know that's something you disagree with. So I wanted to ask you, what is your understanding of palliative?
Palliative care is just making Jose feel more comfortable, treating his pain and just improving his quality of life until he passes.
Have you heard the term withdrawing of care, comfort care? Do you know that?
Yeah, kind of. I mean, isn't it just kind of like removing all the treatments that are keeping him alive and sustaining his life?
Yeah,
basically,
like the breathing machine, the tube feeding, just treating his pain, kind of combination with the palliative care.
Okay.
So now that we have a better understanding of the palliative care, we could talk about more specifics. As far as the pain, we are going to put him on a continuous morphine drip, and that should help kind of alleviate his pain.
And the patient's wishes are such that he doesn't want to be in pain, so we'll most likely just proceed with that. And I apologize that those are not your wishes, but we have to respect patients.
So how do you know that he's in pain if he's not responsive and he's not talking?
His heart rate is up like 30 beats per minute. His facial expressions are, he seems very uncomfortable at times. So, and if I do give him morphine, I see improvement. So that's a direct correlation there.
In the ICU setting, they also have these things called the behavioral pain scale and the critical care pain observation tool. Kind of based on their facial expression and their body language, so then determine their pain level. And as far as the nutrition, we are going to, kind of withdraw that nutrition support.
What are we going to do to make Jose more comfortable?
Well, part of it's all about keeping him comfortable. So we will help you on the morphine drip. We'll be turning him every 2 hours. Just make sure that he's comfortable. We'll be cleaning his mouth, his face. Just make sure that he passes on with dignity. I think that's the main.
I just put the orders in. Is there anything else you want to do before we withdraw care?
Thank you.
Yeah, I mean, thank you for just, helping us understand a little bit more about, what palliative care is. And, it's really tough decision to withdraw the care, but, thank you for just explaining and, yeah.
I understand. That's very difficult for you.
Yeah.
It's okay to cry. Be with us as much as you can for the next few hours, and it might be hours, days.
Okay.
It's okay to cry.
It's okay to cry.
All right, enjoy your day off, and I'll see you in 2 days, right? You're back?
Yeah.
All right.
So I'll see you later, Mark.